Okay, so picture this. A nation made up of over 17,000 islands and home to more than 270 million people. Now just try to imagine providing top-notch healthcare to every single one of them. That is the incredible challenge Indonesia is facing. And today, we're going to look at how a digital revolution is taking that challenge head-on.
So, that brings us to the big question, right? Can technology, we're talking about code, data, and just being connected, can it really solve the deep-rooted health challenges of a country this huge and diverse? Well, let's dive in and find out.
First things first, we need to talk about a system that's under some serious pressure. Because, to really get why the digital solution is so important, we have to understand just how big the problem is.
Yeah, the core issue here isn't just a few little bumps in the road. We're talking about healthcare workers who are absolutely buried under a mountain of paperwork. And on top of that, there just aren't enough doctors and nurses to go around. Plus, they're not spread out evenly. For a country with thousands of islands, that means getting expert care can literally depend on which island you happen to live on. This is the reality that's really lighting a fire under this massive digital overhaul.
So where in the world do you start a transformation like this? Well, you start in the engine room of the system itself. It's all about overhauling the day-to-day operations. And this right here shows the difference perfectly. Look at the left. That's the old way. It's inefficient, it's wasteful, and it's just bogged down in endless paperwork. But on the right, you see the digital future. It's optimized, it's efficient, and it's streamlined. It's a huge shift from chaos to control. So, how does this actually work in practice? Well, our sources point to two really key areas. First, you've got optimizing the supply chain. Think of it like a GPS for medical supplies, tracking them from the warehouse all the way to the hospital bed to cut way down on waste. And second, there's automating all that paperwork. When you digitize things like billing and scheduling appointments, you free up doctors and nurses to do what they're actually there to do, take care of patients. Okay, so once you get the back end running smoothly, the focus can shift to empowering the people on the front lines. It's time to supercharge the clinicians.
And this quote right here, it gets right to the heart of the matter. All the expertise is often clustered in big cities, which leaves huge rural areas totally isolated. Technology is the bridge that can finally connect these islands of expertise to the entire nation.
Now, one of the most powerful ways to do this is with AI-powered clinical support. I know it sounds really complex, but the process is actually pretty simple. A local doctor puts in a patient's data. An AI system then instantly analyzes it against millions of other cases, flagging any potential risks. Then, the doctor gets data-backed suggestions to help confirm a diagnosis. It's literally like having a world-class specialist in your pocket 24/7. But AI is just one piece of the puzzle. The new digital toolbox for clinicians is packed. We're also seeing telemedicine connecting specialists directly with patients in remote areas, smart scheduling to help fight burnout, and digital training platforms to make sure skills stay sharp across the entire workforce.
All right, so we've upgraded the system, we've supercharged the doctor. Now, it's the patient's turn. It's time to go from being a passive person getting care to being an active partner in your own health.
And this happens through something called a patient engagement platform. As you can see, this is way more than just another app. It's a whole support system built on 4 pillars, giving you solid health education, tools to monitor yourself, connecting you with peers for support, and helping you make healthier choices. So what does this actually mean for you, the average person? Well, it means your healthcare doesn't just stop the second you leave the doctor's office. Let's say you have a chronic condition like diabetes. This platform helps you track your blood sugar, it gives you reminders for your medication, and it keeps you connected to your care team, all from your phone. It's all about managing your health every single day, not just when you have an appointment.
So what happens when you put it all together? You've got efficient operations, empowered doctors and nurses, and connected patients. Let's take a look at the big picture for Indonesia's digital health future.
When you boil it all down, it really comes back to 5 key areas of innovation.
In this table right here, this is basically the blueprint. You fix the operations to make the whole system more efficient. You add clinical support to make it smarter. You support the workforce to make it sustainable. And you engage the patient to make it truly effective. See, it's not about one single magic bullet. It's about how all these different layers work together to build a healthier nation from the inside out.
So here's the bottom line. The technology is here. The blueprint is on the table. The vision for a healthier future for Indonesia is crystal clear. The real question isn't if this transformation can happen anymore. It's how fast it can be built, and what it's going to take to turn this digital dream into a reality for 270 million people.